what is an LVAD, Left Ventricular Assist Device, and when do you use that for patients with heart
Don't
failure?
discuss that while we're talking. Yeah, this is heart transplantation. Go down further.
Down further.
Go down further.
Biopsy.
This is it. So we can talk a little bit about this. Left ventricular assist devices are a unique device. It is a niche therapy that's designed for a specific type of patient. And that patient is a stage D heart failure patient that may or may not be a candidate for heart transplant. And we have come a long way in terms of understanding how to support the heart. Starting off from 1903, as you can see, Charles Lindbergh and Alexis Carrel, they designed the first organ bypass devices. They were experimenting on animals, taking out organs, cats and dogs, and they would make those organs survive using these devices. And then we eventually got the coronary bypass machine, which is the most instrumental device that progressed or moved the needle forward for cardiac surgery. And it was a massive device. John Gibbon was an anesthesiologist who devised this. And this was a massive device. But that's allowed us to start supporting the body if the heart wasn't functioning. Next, you can go to the next slide. And slowly, everybody wanted to say, okay, if we can support the device outside, why can't we support it inside as well? So then Dr. DeBakey, really, who has had a pretty renowned career. In fact, where you are, there's a building named after Dr. DeBakey. But really, he was working diligently in the 50s and 60s to create that. And he actually hired a surgeon, Domingo Liotta, to create the first total artificial heart. Remember, they were trying to create the first total artificial heart. There was a race for going to the moon. They wanted to create the total artificial heart, everything. This was all sexy at that time. They hired people, and Domingo Liotta brought his experimental device to the forefront. And then in 1966, they implanted the first device called the Liotta-DeBakey Corpio Left Ventricular Assist Device. And really, as I said, there are two ventricles, right and left. You can support the right ventricle, you can support the left ventricle. Depending on that will call the assist device. Left ventricular assist device is more common because left side is the main pumping chamber and fails the most of the time. Right side can be supported as well. You can have a univentricular support or you can have biventricular support. So that's what it is. It's an assist device. It's not taking over function. It may, but it may not. But it is there to help buddy up with the heart that's weak in the background, support the body, support the circulation with some nuances.